Good evening, everyone. Welcome to the show. Welcome to the show. Your host of the show, hosting up the city uh, earlier yesterday. This week, you are joining us. So, you know, thank you. You know, you know, just let you know that second service is always about bringing you the truth and trying to give you a different perspective, inside perspective, so that you can make a more informed decision, whether it's against in your community, whether it's in the workplace, just in general. And tonight, we're going to be talking about the topic that has everybody kind of upset and worried, which is about sending our children back to school in the midst of a pandemic. This pandemic is still going on. We see a lot of the states are rising in numbers where they should be going down. Some that were going down, including New Jersey, were going up. And it's simply because people are just not adhering to the rules and the regulations and the recommendations that they're putting out there. And because of that, we see our numbers going back up. And what we have to really be careful is we're moving into flu season. And when flu season comes, this virus has a possibility of mutating. And if it mutates, that's going to be another monster that we're going to have to deal with. And right in the midst of this, we are sending our children back to school. A lot of the president of the United States is trying to order kids to go back to school. We can cancel rallies and party affiliation conventions, but we can't cancel school. We can't keep our kids out of school. And the question is, there's two sides of the argument. One, it's bad for the kids to stay out of school, okay, because they've been quarantined, they've been inside for so long. There's one argument there. And the other argument is, they shouldn't go back to school. And what we want to do is try to talk about those issues today. We want to look at both sides. We want to talk about both sides. We want to have a conversation. We want to have a discussion. So as always, I have two of my friends here, my expert commentators. I have Detective Stephanie Treadwell, retired detective from the Newark Police Department. There you go, Steph. And my friend, retired detective Anthony Cox from the Essex County Prosecutor's Office, who is joining us on tonight to have a discussion. In our time together, Stephanie has brought up some good questions about the mindset of children and the health and well-being of children. And Anthony, although he's retired, he's in charge of security in one of the school systems right here in Essex County. And, he has a big role, so he sees it firsthand. He has an idea. He's involved with the emergency management aspect of the job. And they're talking about the COVID, how to implement the different policies and procedures he's going to be faced with in September. We know some schools have opened up already. You know that they're open up, but New Jersey is looking at the month of September. So we still got a little bit of time to talk and hopefully get some word to our elected officials and voice our concerns. But before we do that, I want to just have a moment of silence for Miss Shirley Rice. She is the wife of Senator Ron Rice. And then those of you who know Senator Ron Rice, he is a senator who's on the front lines, always fighting for the community. He's not one who sits back. If it's an issue, he's going to fight for you. He's definitely fighting on this issue, but he's also big on police reform and making our communities more safer and holding people accountable. So I'd just like to take a moment, have a moment of silence. He lost his wife today. Stepmom of my good friend, Ron Rice, who's down in Maryland, who we ran together in 2012. So we want to just have a moment of silence. Thank you. Thank you. Thank you. So guys, listen, I want to show an image to our viewers tonight. I want to show an image to our viewers. If we can have the image up there. Now, this broke my heart because being that I work in the healthcare industry now, I know what it's like to wear that mask. I know what it's like to put that shield on. I know what it's like to be inside, to have. Now, listen, I can barely deal with it for the short time that I have to have one, but I know nurses and doctors who have worn it for 12 hours straight, and it's a lot. And now we're asking our babies to have to wear this type of equipment to go to school. And I saw this picture. It just broke my heart. It just broke my heart that this is what we're, this is the new, this cannot be the new normal for us. You know, we have to do better. And to send our kids out the door, what parent wants to send their kid out there? Like, I mean, this is like equipment that we see firefighters wear and everybody else wear. You know, we put on protective equipment, hazmat, you know what I'm saying? And we want to send our kids into school. So, you know, we have, you know, it broke my heart. And Tony, I thank you for our guest tonight. We have a special guest who is very in tune with what's going on. He's a, you know, someone who knows. He's been involved in a lot of what's going on in the community. And I'm talking about none other than Mr. Tyson Rasul Dawood. How you doing today, my brother?
All is well. All is well. Such a pleasure and honor to be a guest on this show. I'm a big fan.
Listen, man, we welcome you, and we want our viewers to know who you are. I just want to say a little bit about our brother. He's educated, and I tell you, he's got a master's degree in educational leadership and is currently seeking his doctorate in educational leadership at St. Peter's University, and we expect to have that in 2022, my brother. Nice. All right. And one thing you need to know about Tyson is that he has a mind to lead and a heart to serve. That's big. I like that when I was reading up on you, man. And, you know, you feel at home. It says you feel at home, most at home in a school as a workplace learning coordinator at PTech in the Patterson school system. You've been involved with autism awareness, anti-violence programs, the My Vote is Power Coalition. You've been involved with the NAACP, the Urban League, and also, this is a big one for you brothers, prostate cancer awareness. And you also formed the Together We Can Coalition with the Divine Nine and other fraternal organizations, Rutgers University, and law enforcement agencies. And this is what I like about it too, about your bio. It says, he has been guided by his motto of Muhammad Ali. Service to others is the rent you pay for your room here on earth. Now that's big, man. People don't understand. Yeah, that people don't understand why first responders and folks join police departments and stuff like that. But the reason why they do is because of just what you said there. You know, provide. Some people feel good giving service to others. I know that's why I got involved with it. That's why I'm still involved with it. I could be doing so many other things, but my whole life has been one of servitude. And I guess what? I enjoy it. But, you know, I talked a little bit about you, but why don't you expound a little bit more, maybe something we don't know, and let us shine some light on something else that you're doing, man, because you're doing a lot, and we appreciate you being here.
Yes, and I'll just talk in general. You know, I believe that organizations, as well as our police departments, our school systems, we all need to work beyond the walls of where we're at. Work outside of the police department, work outside of the school. You may say, wait a minute, of course they work outside of it. I mean, work with the community to become a part of the community. I'm definitely just that type of person, a community person. Once we get involved in our communities, then we make them stronger. And John, like you said, is a lot of other things that you could be doing, and myself as well. And you know, like I have some young sons, and you know, they're young men now.
Yeah.
So, money isn't everything. It really isn't. It doesn't buy happiness. However, if you take time to do work within the community, it'll go a long way for you and that community.
Yes, that's true. That's true. And man, we appreciate you being here. But I mean, listen, this is a serious issue. You know, I have a granddaughter. She's 13. She's going, you know, she's one of the schools, of course, that are going to be looking to reopen. I'm not sure they're quite sure on how they're going to reopen. You know, we have others have grandchildren. Some mothers who are watching the show, they have children. And, you know, there's some serious discussion that we need to have tonight. And one of the first things to open up is if you know
if you know, how are the schools planning to be open in September from the best of your knowledge?
Well, the school districts are taking directives directly from the governor and the Department of Education. Um, and what the Department of Education, our governor, has stated is that he's giving them a choice because most of the districts, especially the urban districts, have sent out surveys to the parents to release them from the responsibility of making the decision. And from a lot of the districts that I have heard the superintendent talk about it, they're saying that it's almost 50-50. 50-50 want to do a hybrid, 50% want to do a hybrid, and the other 50% approximately want to do 100% online. So how do you best satisfy that? Well, you offer the parents a choice. One thing I do agree with the choice is that it allows less students inside of the hybrid classroom. So we have 50% that are going 100% online. Now we chop down the 50%, which will go 25% on one day, online the next, 25% on one day, uh, and then so on. So that's what we are looking at. A lot of the districts, including mine. By the way, I do not represent Patterson Public Schools. Everything I say is coming from my mind, Tyson Rasul Daoud, as a citizen of New Jersey. I just want to make straight. But there was something that came out letting them know the plan is out. So a lot of our, including Newark's plan is out, and a lot of the districts are releasing the plans out to the public. And I heard the plans a little earlier. They are thick. I mean, they are going to very, very detailed plans. It's not something where, okay, I'll read about 10 pages and go through it. No, it's very detailed. So if our parents have a choice, okay, that takes the liability off of the district. Now, questions that aren't answered are what happens if the parents change their mind and different things like that. Okay, but the most probably, I shouldn't say the most, but one of the most important things is the reaction of the teachers and the staff themselves.
Yeah.
Their comfort level.
Yeah.
Let's think about it. I'm an inner city teacher, and we deal with different issues. And teachers put their lives on the line quite a bit in school systems. Look at the school shooting, who gets killed, the administrators, the teachers, because we treat them as our own children. But now teachers have to make a choice because if you're like me, I have my senior citizen grandma, I'm a mother, excuse me, who lives with me. Okay, so if I bring something home and I give it to my mom, or a student gives it to the grandma, I can't forget.
Right. Right. That's a very important point because when we look at, I just saw that I think it's New York City that's going to start tracing. They're going to start doing contact tracing, and they're serious. They're talking about fines up to $10,000 because regardless of what you hear from the daily briefings from Washington, children can contract and bring and carry that virus. Now, the issue is not so much the child getting sick, but everyone that child comes in contact with. So when the mother leaves the child with grandma or grandpa or uncle, and one of them have pre-existing conditions or some type of challenges, health challenges that they might be going on with now, that's where the risk comes in. And that's where, I would be concerned. I mean, like even with my granddaughter, I'm a cancer survivor. So her coming to me, by the grace of God, I'm still working. I'm been blessed not to contract COVID, but I know people who have, like diabetes and, they have other heart issues and they've contracted it, been hospitalized and have not come home. And, it's a serious issue about, it's not so much our children. Yes, they have a different robust immune system, which might keep them from getting any of the bad effects of COVID, but nevertheless, they can be asymptomatic and carry it and bring it home to their parents. And then now it's a whole situation. So it's a great question of liability here about sending kids into that type of environment. Because let me just say this: kids, I teach kids karate, and when they get sick, I get sick because they bring the common cold. It seems like they just come in there with a bag and they just carry it. It's all over them, and it just jumps off on everybody. So the mother will be sick, the father. I say, hey, where's little Johnny? Oh, we were all sick with the cold or the virus. And then little Johnny's fine, but now dad's out of work, mom's out of work, and everybody else is home. So I mean, yeah, that's a great question. I mean, that's a great point too. Yes, there should be. It's interesting that it's like 50-50. It's
very.
Yeah.
And it just to expand on what you're saying, there are a lot of, like, I have a friend I just found out today. His son is about 20 years old. It has the antibodies. And he's been coming home to where mom, sister, and dad live. And everyone may have the antibodies or they may not have.
Right.
They were blessed and they did not catch COVID. We've been exposed.
Yes.
I think it's impossible for no one to have been exposed to this deadly disease. It's just you hope so. Well, I hope I was exposed, got the antibodies, and it's out of my system.
Yeah. It's and this virus is so it's so easy to catch COVID, and we're still finding out how you catch it. Like, all right, a lot of us, we're wearing masks, but you can catch COVID through the eyes, and that's another thing. So if someone is sneezes or talking, and you walk into the mist that they left, and your eyes are uncovered, there's a possibility you can catch COVID that way. So it's very serious. So let me ask you another question. And I think you might have said this, but how in your opinion, and you're not representing any particular district, but in your opinion, how do you think they should open? Maybe some of our viewers can hear what you're having to say, and maybe when they go to meetings, they can make recommendations based upon your experience. Well, how do you think they should open, and why do you think they should open that particular way?
The number one goal of school systems is the safety of the children and the safety of the staff. Mm-hmm. Because if the climate does not push the safety of either, it's not a good climate.
Right.
It's just not.
Mm-hmm.
My personal opinion is no ifs, ands, or buts about it, being that before the education of a student, their safety comes first. We should go 100% online. 100% virtual.
Right.
The problem is what gets intertwined in this, in the grand scheme of things, is politics.
Yeah.
People who get elected, they have 50% of the people. I'm using approximate, and not every district, but just I heard those numbers from a couple of different superintendents when they spoke on public forums. Where 50% of the people who vote for them say one thing. Well, that comes into play, and unfortunately, it plays with life.
Yeah,
it's realistic. I truly believe the way the plan has been outlined is to protect everyone. Say, well, we told you that you have a choice. You could have left your child at home, so it's not a big liability. But the biggest problem comes in is the teachers union and potential lawsuits from teachers. And we do see, and I'm not an expert on it, but we do see them trying to put something like that together now so that the teachers feel safe. But that's about it. Realistically, the problem, everyone expects schools to do everything perfect.
Mm-hmm.
Say we're gonna decrease funding, but you have to get better.
Yeah.
You have to. You're the reason my property taxes are high.
Right.
All right. Yeah, but while at the same time, your home values keep increasing too. I don't like high taxes. Don't get me wrong.
Right.
But you can't decrease funding and expect a better result.
Right.
So there is no 100% answer here. It's a pandemic. People dying every, I think they said 8 minutes or 8 seconds in the United States, or 80 seconds in the United States of America.
Mm-hmm.
It is a pandemic. There is no perfect answer. We
Right.
are going to make mistakes.
Right.
People are going to die. There will be spikes. But what we have to do is be safe about it. Because
Yeah.
if we at least go 100% virtual, that's a starting point.
Yeah. 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 You know, that there is going to be a spike. We see it already with
Sure.
our kids who are going out partying on the weekends. You know, we see it, and the spike is going up. The governor's rolling back some of the things that he's doing, and you said something very key, which I think affects not only the educational system but also law enforcement, healthcare. No one has dealt with this type of pandemic before, and it's new to them. And you know, I mean, this is like shutting down everything. You know, the crime is up because the pandemic, because people are home, without a job. So number one priority, you know, is self-preservation. Anybody, you're going to eat. So folks who might not have been involved in doing stuff are doing things.
Mm-hmm.
You know, so crime goes up. You know, and then the same thing with the school. You know, no one really has a solid answer. We're trying to feel our way through this thing. But I want Steph, and Steph had a good point. She had a question, I think, that I think she wants to put to us, and I think of some of the viewers might be thinking like this too. Steph, you wanna bring that question up that you had?
Oh, the one okay, 1 second.
Yeah.
My question is, I don't know if you can answer this or not, but if the kids went back to school, okay, say one kid had got sick, okay, from that, okay, then they shut the classroom down. But in my opinion, I think they would have to shut the whole school down because that child wasn't confined to that one classroom. But what happens, the staff, the teachers are do how do they do you know if they get sick leave or if they took that home to someone in their house, then they would have to care for them. Would family leave kick in? Or, you know, that's just a question.
I'm very glad that you brought that up, Steffi, because right now we're hearing quite a bit about those type of discussions are going on. It's ongoing. It's ongoing at every level. Something the Department of Education is going to have to deal with, as well as the teachers union and the individual district. As at this time, I don't think that a decision has been made clear with that. And don't get me wrong, because a lot of plans have rolled out, and that may be a part of one of the plans of the many districts out there. But the unions are at a big battle
I
over what those cases, because we have to be fair. I mean, it's the teachers going back to school makes the teacher like an essential worker, a frontline worker, because just like John said, when sickness comes, it goes through the school like wildfire. And I know Cox, he definitely knows working in the school system. Everyone gets it.
Yes.
I was at a school and the principal said, look, when they get these symptoms, call the parents and have them go home, because this is not COVID. This is pre-COVID.
Yeah.
It's because everyone's getting sick, including us inside of the office.
Right.
And we're out for a week. So if you put these teachers in the classroom, how are you going to deal with it? My daughter, she's going to be a freshman in a couple of weeks, actually, at Howard University, and they have certain levels, because I read it very closely, of how the staff will be treated, whether or not say, hey, if you're over 65 years old or you have these conditions, you're going to be an online teacher, okay, a professor. Maybe that is definitely something that we need to look at because we have to accommodate our teachers' conditions and their vulnerability to this deadly disease.
Well, I got a question following up on Stephanie, because listen, I understand teachers go in their pocket and buy supplies for their
Lord, yes.
right, which is, we did the same thing, Steph, in the department, and we went out because it was a need and we wanted to fulfill it. Who's going to supply the PPE for the schools under this? Yeah, I mean, because if teachers are coming out of their pocket to buy supplies, that tells me the school district is lacking something in the area of funds. And I know PPE. I know what PPE costs. I know how much masks cost. Our system is getting ready to order 7 million masks for our entire system. But when I look online for a box of the masks that we're getting ready to order, they're charging like $700 for like a case. So my question is, if you don't have enough money to buy supplies for your classes, who's going to supply PPE, face shield, mask, surgical mask, and not for one mask and one face shield for 30 days, because you're going to use more than that. Surgical masks get dirty, you can't use them, they get ripped. So who, if I mean, that's a question for you and Tony, if there's been any discussion.
Actually, I'll start off, and then Tony, you can take it from there. I can. What I'm saying is very, very public, and that is going on. I know in Patterson, they are providing all of the students, the district, and the staff with plastic partitions.
Okay.
Anyway, which is thumbs up.
Right.
Thumbs up. On top of the PPE. So in saying that's phenomenal. Look, if we have students and we're mandating that they have to wear PPEs and have protection, then we have to supply it. Patterson has, it's public knowledge, fed tens of thousands of people since the pandemic started. Monday through Friday, provided food Monday through Friday. So a lot of our student population, they depend on 2 square meals, and this is inside of the district in general. 2 square meals from the district. I can't even comment on how many teachers, including myself, break the rules and hold back food for students who are hungry at the end of the day, or for them to take food home. Breaking the rules, but it happens.
Yeah,
it's a reality. So if someone has to choose between a meal or purchasing PPE, we know that family is going to choose. So it's only right that the district to give out the supplies to protect the students and the staff.
Right. True. Yeah. Tom, what's going on? What are you hearing as far as that?
I'm pretty sure most New Jersey schools will follow suit with, what passed down the line. And it's all about the safety of the students and the staff. That's what it comes down to.
Right.
And, they'll follow suit with what guidelines they put in place, and that'll be that. We have to work with what we have. It's like it's uncharted waters. We all going through the same issues across the nation. My concern is, will students in urban areas be covered and protected the same way as students in suburban areas?
Oh,
great question.
Equity, because we all know the issue of equity with our schools,
exactly,
and other schools.
Yeah,
New Jersey. There's a clear division.
Yeah, there is.
It's obvious. It's obvious. I'll go back to the 80s when I was in high school, and the books that we had, they were literally falling apart. I always looked for the positive thing in everything. Okay, right. So one thing that the pandemic has caused is more equity to our urban district.
Yeah,
Chromebooks, laptops, and different things like that. Yeah. Other school systems, they had technology for quite some time.
Yeah.
For like the last 10 years, everyone gets an iPad.
Yeah.
Everyone gets a laptop. Their books are on iPads.
Right.
Or, inside of the laptop. So what this crisis has forced the districts to do, because in order to educate the students, they must have a device and not a phone.
Right.
Google Classroom, who most people are using, is hard to use on a cell phone.
Oh, yes. 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 Yeah. Yeah. Because just looking, like when I travel, we have hospitals in almost a lot of the cities across up and down the state. And when I go to different cities and I see the PPE that different cities are wearing, there's a difference, and then if you have the PPE, I see a lot of times people wearing the PPE, but they're wearing it incorrectly, so it doesn't really do anything. We have to teach nurses that the masks that we're supplying them with are supposed to fit their face really, snugly.
Right.
And there's a way that they have to, do this procedure so it will fit tight, so there's no gaps for COVID to get through. Imagine trying to teach an 8-year-old or 6-year-old child about a mask and how to keep the mask on. The mask is going to be down here, the mask is going to be there, it's going to be ripped, it's going to be that, because this is what we're doing. So I mean, it's not only about masking and putting up the partitions. You have to give the education as well as the equipment. That's one thing I've learned, that if you have the best equipment but don't know how to use it, is not going to help you in any type of situation. And that's what I want to do. Yes, Steph. Mm-hmm.
How about the kids? Who's going to be monitoring them with those masks? Some of them not going to know how to put it on. Some of them go, oh, you got a Batman one and I got a Superman. Let's switch.
Yeah.
Or they do the I made one from home. Yeah, kids start. That's not a real one. That's different little things. I don't want to say that word, but that what they do.
That's what they do. Yeah. Listen, I dare somebody wear a Giants mask in front of me or a Steelers mask in front of me.
Oh, where's my mask at? I got one.
Oh boy, here we go. I shouldn't have said that, but but that is, like Stephanie said, and Tony's also brought out, that's something that kids do because they're kids. We're talking about children. Why are we subjecting them to do things that we discipline adults for on the job if they don't follow suit and don't do it right?
Keep it on all for the hours that they're in school.
Hours. Yeah.
That's the hard part. And my issue is what for a question I have for Mr. Dawu, what other issues or problems do you see schools having once they open? As far as social distancing, walking throughout the hallways. I saw on the news down in Georgia, I believe, Valdosta, Georgia, or Valdosta County, whatever. They were all over the hallways, no masks. Maybe 3 out of 30 kids had on masks. Now what?
Right. And that comes to the climate and the culture of that school.
Right.
Mm-hmm.
Being what we do and how we do it. And the culture means the safety that the kids feel when they're inside of the school. So what's key is classroom management and school management. And teachers and education profession, the way that we address that is through the climate and the culture within the school. Now that sounds like a very easy answer, but a lot of educators, they struggle with it, especially your less educators. Believe me, I went through it myself. And dealing with the younger children is all about the climate of the school and the culture within that classroom. Okay, so what we have to do, if we spread them apart a little bit and we teach it, it becomes a part of our climate. Then they'll catch on. It's not easy, of course, the younger you get, because you're dealing. Especially, personally, I'm like, how do I do this with kindergarten kids? Yeah. Okay, yeah. I mean, I teach older kids.
Okay.
Generally, kindergartners, they scare me.
Yeah, me too.
Give me the middle school, give me the high school, give me 4th, 5th, 6th grade. But the younger they get, because you really have to teach them. So this is where getting the parents involved is a must. Because the training, as far as the PPE, it has to occur at home,
right?
Well, as a school, as the school, so it's not new to the student.
Yes.
And really, that's with all of the ages. When this first, everything first happened, I called a virtual family meeting of everyone, and we talked about it. We talked about death. We talked about we may not make it. All of us may not make it through this pandemic.
Right.
And how are we going to deal with it? And are we going to be safe? Okay.
Yeah.
Are you going to come see your great grandma, or are you going to see her virtually because that is what's safe right now?
Right.
Because he's very vulnerable because of age. The training has to come at home. It's essential that it happens in two ways. The parents take responsibility, and also the school and the teachers, they take responsibility of educating the parents. And that could be done through workshops, during PTO meetings. And you say, well, only 10 people come to the PTO meeting out of all these people. We have to get this information out to the parents. They have to be in on it, okay? Because we're dealing with something that's imperfect.
Right.
There isn't a correct answer. We know for hearing multiple superintendents say it, they meet and discuss this. The superintendents, they're trying to figure this out.
Yeah.
They're trying to figure it out.
Yeah.
There's also a question from Rose Wilson. She states, who's going to monitor the kids when they have to go to the bathroom? Now, in where I'm at, we have security in the hallways. Also, there are other monitors. So one is stationed near the bathroom. Kids come out with a pass from class, go straight to the bathroom. That's how we do that, before COVID.
That's it.
Of course, it's going to, be adaptable or changeable to whatever, maybe 3 or 4 kids have to go. You have to do the social distancing and make sure each classroom or teacher or an aide monitors who's coming out of that classroom in that area to go directly to the bathroom and come back. So it's some type of system each school is going to have to make to get that, everybody has to change up and just have a system in place. A, B, C, and D. What if this happened? That, just have to be, mindful of that and be ready to adapt to any change that we have.
Yeah.
It depends on whose way that we take. And just like Cox said, a lot of the high schools and urban districts already do this. Okay, a lot of the rules, that's what we do. That's a part of the school, it's a part of our culture and our climate. We see it in the high schools, we see it in the middle schools, and we see it in the elementary schools. And it's for safety issues. And the teachers work with administrators, work with security to make sure everything goes okay. And I see in schools where certain teachers are assigned to the bathroom duty, and they can swipe in and swipe out with their ID to go to the bathroom, so you know who goes in and how many are in and out the bathroom.
Mm-hmm.
I don't think that's going to be a big issue,
right?
At least in a lot of the urban districts.
So when it comes to creating policy, because that's what that's what we're going to be judged on is policy. That's what we're going to be find liable with good policy or bad policy. Who's making the decisions and coming up with these ideas as far as how to bring our children back to school? Well,
policy is in school districts are created by the Board of Education.
Okay.
There could be recommendations that go to the Board of Education at their meeting that they vote out. But they create the policy of the school district.
Okay.
Not to be mixed up with school rules, or people like to call it the policy of the school. It's not truly the policy. It may be the rule of the school created by the principal or some administrator, but the policy has to go to Board of Education. They have to vote it out. A lot of times they introduce the policy themselves, and that's where it comes from. You're in most districts I shouldn't use the word most, but districts have either an elected Board of Education or an appointed, a lot of times appointed by the mayor, Board of Education. And that's who's going to make these decisions in the end.
So we talked about the children, we talked about parents. How about the teachers? What is the feedback from the teachers? Because one, if I was married to a teacher, I'm like, I would have some issues. I would have some questions. And, you know, what do the teachers feel about reopening the school and how it should be done? Do they even have to say so in what goes on?
Great question. And I'm going to go back to where I stated, if you notice when I talked about school safety, is the number one. I said students and staff.
Gotcha.
The safety of students and staff comes before everything. Okay, right. It's paramount. It's something that must be addressed. Teachers are human beings just like the rest of this country. They're scared. We deal with the social emotional needs of the students, and we must also deal with the social emotional needs of the teachers. That's a must.
Yes.
This pandemic has proven the slogan mental health is real. It affected all of us. If it didn't change you, God bless you.
Yeah.
Okay.
Yeah.
It changed most of us tremendously.
Yes.
I can say that myself, speak for myself. And so it has made a change to our teachers. Our teachers have lost family members. Our teachers have lost parents. Our teachers have lost friends and associates, just like anyone else. And it affects them. So we must take care of the social emotional needs of staff to be effective.
Right.
Like I said, people expect teachers have so high expectations, which we should.
Yeah.
While at the same time, okay, we have things that's more important to teaching than us, like our family. That's our priority.
Yeah.
Our God. That's our priority before education. Okay. Yeah. And it's only fair. It's only fair. So we as teachers want to protect themselves from COVID. The reason being is because they don't want to bring it home.
Yeah, that's key. And you're gonna have to I just foresee the teachers being included, like the first responders,
right,
doing the same thing that nurses and doctors did before they got home. They sort of decontaminated themselves and isolated their clothing and stuff like that, so they wouldn't bring it home into the family. And you know, then regular COVID checks and possible quarantines and stuff like that. Because you know, I mean, in the average class, you have about at least 15 kids, right? I mean, it's been a while since I've been in school, but at least.
What are you talking about?
Yeah, right. Because I know I know the bigger cities you have more, and you know, so let's say you have 40 in a class. That's 40 opportunities for you to catch COVID as a teacher, and then bring that home to your children. And now what we're seeing now with the COVID is that children are catching it and dying. Yeah. So it's not that like the president says, oh, they're resilient. They have no, sir, they're dying now because now we've allowed it to go on and mutate. And now the new strains that come in, just like one thing, I was talking to a coworker of mine, and she said, you know, the vaccine that they're going to come up with, by the time they come up with, it's going to be ineffective because just like the flu, every year we get a flu shot because there's a strain. It's still the flu. It's whatever you want to call H1N1. It's still the flu. It comes from that family. And coronavirus is still a virus. So by the time we get the vaccine, it's already mutated because our body has fought it, built up antibodies against it. And now there's a new strain out there. And that strain is stronger. And that's what we got to watch out. So with teachers, that has to be part of the conversation in the room for teachers' safety concerns, because vice versa. Just like, you know, the teachers are out, you know, and amongst each other. All right, teacher A meets with teacher B. Teacher A has COVID. Teacher B doesn't have it. Now it's passed on. And now teacher B brings it back into the classroom with the kids. Now it comes home. So, I mean, yes, you know, precautions have to be taken. And, you know, I really see that being something that's going to, I just don't know. I just don't feel comfortable with the reopening being so close that we're just reopening the state, and now you're talking about reopening schools. Listen, we haven't reopened the gym yet.
Exactly.
Okay? I can't get my fat behind in there to work out yet, and you telling me you're putting kids in school before I can go back to the gym? I mean, that's ludicrous. I mean, you have to think about these things, you know? So it's like, come on. I mean, let's have some common sense. You know?
I want to comment on one thing, if I may. The people don't realize this is the 2019 coronavirus.
Yes.
This has been around.
Yes.
People have gotten coronavirus for years. This is COVID-19 is COVID 2019.
Yes.
Okay. And also, we're at a point right now in education where, for the first time, I remember someone said they were a teacher. You know, people darn near bowed down to them. And now educators are under attack.
Yeah.
It's popular, and I'm not just going to blame it on my beautiful state, New Jersey, because if you take a look at education across the country,
Yep.
cuts, recommendation to do this and do that because taxes are too high. Why? Because teachers cost property tax payers about 50%, 50 to 60% of their property tax. So, hey, we need to cut that.
Yeah.
Okay. Well, that's a problem. That's a problem because I know it sounds corny, but it's very, very obvious. Every great person came from a great teacher. Every.
Yeah.
Just like my friends are surprised how busy I am now that school is out. I say, oh, I'm so much busier getting ready for what's coming up.
Yeah.
And we sitting at home watching the stories, General Hospital. If that still comes on, I don't know.
Sesame Street.
Yeah, I'm like, oh my God, like I'm into dinner.
Yeah. I'm gonna open it up, but I just want to say this because Steph had bought a comment. We talked about this before in another show, the mental, and we just talked about it. We touched on it today, the mental part of COVID-19. Now, I'm into officer resiliency, operational stress management. I just went through training. I'm a trainer, and we can't send people out there who are, like you said early in the show, we have to take care of ourselves first before we can help anybody. Just like in an airplane, you have to put the mask on first before you can help, the child.
Mask.
Yeah, you know what I'm saying? So I went to operational stress management training, and I'm an advocate for it. I'm like, listen, we need to introduce this into police departments since we're talking about police reform. But when I dealt with COVID, I said, wait a minute, I wasn't trained for this. And I'm finding myself now because my body is used to shutting down around this time and relaxing and going places, but there's no place to go. I mean, I looked at the map and the only place that would let us come in was Mexico, but I don't want to go down to Mexico and get sick because they have a spike and they have, their healthcare system is not the greatest healthcare system. They said, they told me, bro, if you get sick in Mexico, whatever is wrong with you, get on a plane and come back home. Don't go to the hospital. And I said, wow, I never, I looked at it. I mean, man, I was like, I could have
organs.
Yeah. So we're not really, for those of us who have some sanity left, and people will question that if I'm sane or not, but I think that I'm pretty sane, and it bothers me. So the stress of the kids, if we don't send the kids back to school, to something that they're used to doing, has that even been a discussion in the boardrooms or in the rooms where they're talking about opening school, the mental health aspect of kids not going back to school and just doing everything virtually as we're talking about?
That is a phenomenal question because it's definitely part of the conversation because we see it day in and day out because we interact with the kids constantly. And we've had situations where students have to go to work and they couldn't attend their virtual classes. And we just say, oh, how dare the parents? We got to bring food home because parents are laid off and their income isn't coming in or has decreased substantially. So they have to go to work so that they have a roof over their heads. We're dealing with that.
Wow.
Especially in some of the, in the bigger cities. That is a reality. And we have to work with them. Of course we do. Because their safety, having a roof over their head, and food is extremely important. It comes before their education because you have to address those that hierarchy of needs.
Yes.
Before they can learn.
Right.
Okay.
Right.
Before you can take them up in different levels of learning to a way that where they'll flourish. They're not going to learn effectively hungry.
Yeah.
Or not having a roof over their head.
That's true.
Or if their parent or the loss of loved ones inside of their house.
Right.
It is a problem. That is the social emotional needs of our students that we're used to addressing all of the time. Believe parents don't realize when they have problems at home, it comes to school. And a lot of times, and Brother Cox can tell you, they bring it to us and they need advice. They need us. They depend on us.
Yeah.
And in these times, the mental health of our students, they are going through quite a bit. And see, I hear a lot of other districts, they are more focused on, they're not going to have a graduation. Well, if you go to Newark, you go to Irvington, East Orange, Patterson, they have different needs. We're talking about food here.
Yeah. Yeah.
Okay.
Yeah.
Tens of thousands of meals are going out every day in one district. Excuse me, not every day. Over amount of time in one district. You would think, I'm not going to go get free food. Are you kidding me? They're coming out in big numbers.
Right.
In big numbers. So our students, just to reel it back in a little back in, our students are going through a lot. They're dealing with real big boy issues. And we, as a school district, we have to address them so that they can learn. We have to address them first so that they can learn. We have to.
Yeah. Yeah. Wow.
Yeah, it's powerful.
Wow, man.
It's real. Cox knows. That's it.
Yeah. Yeah. I see, just stepping out of the box from what I'm used to, which is law enforcement, and seeing the different disciplines out here, education and healthcare, and it's different. I mean, everybody has something to do, and it falls under protecting and serving. And like you said, children can't learn if they're hungry. That's been proven. That's been one of the things from Michelle Obama. Michelle Obama brought that out. Was like, listen, they can't think if they can't concentrate if their belly's growling, because that's a big thing. And I know, Tony, you had food programs going on. I believe when we first closed down, I think that you were there just to make sure that it got distributed and nothing went wrong. Yeah.
Yep.
I mean, that's it's a little, to some people it's a little thing, but to us, it's a big thing when you see children hungry. I mean, I've actually seen children, I know they were hungry, and said, listen, let me give you, come on, get a sandwich, get something, come on with me. And they have pride. Our children have pride. And,
oh yeah, definitely.
And they don't want handouts, but I mean, it's the way you do it. But man, we are really faced with a lot moving forward. We have a lot to talk about, and not that much time. Georgia failed. One of its schools failed its first day of opening. I just read the headline. I was looking at the headline, and it said Georgia failed. And and I think, Tony, that has a lot to do with what you were saying with the crowd, with the kids walking in the hallway. There was no social distancing, and if you got to change classes, everybody can't change class at once.
Same time, depends on how many students are in the school, how many in the hallways at the same time. I mean, you have to revamp the whole process.
Right.
With a plan A, B, C, and D.
Yeah.
Actually, in case this happens, what do you do? Plus also safety concerns are still involved, and then other issues that might arise from there. What if something happens within the school? How do you react to it? So it's a lot of things you have to, put into place.
Yeah, we're really, this pandemic has really, we're taking this as a breather.
Thinking about also our safety drills. what do we do with that? You know, drills that the way we used to do them, we can't do them like that anymore.
Right.
You know, so active shooter drills, just fire drills, everyone has to be separated now. So,
Wow.
Yeah, you really have to be.
My goodness.
Wow. Well, we're gonna listen. We're coming down to the wire, and what I like to do is open it up to the commentators, and for some final questions or remarks, and then Brother Tyson, we're gonna give you the last remarks, as we say, the closing remarks, and then I'll take it out. But Steph, anything else you feel that you saw like that we should be concerned with, or you want to ask of our guest on tonight about what we can do moving forward in the with the school reopening?
No, I think that he just really shared a whole lot of information. Information is no good unless you share it.
Right.
My concern also is I know a lot of parents were concerned about they had to go to work, and that's why the kids had to go to school. But if the kids going to school half a day, then what happened to the kids the other half if the parents is going back to work full time?
Yeah.
It's a mess,
Yeah.
So and it seemed like right now there's really no answers for that. The only answer would be for this COVID mess to just go on some, drop it off in the North Pole and freeze it.
Yeah. Jerome Dunn said that, speaking about Georgia, he said that the Georgia student was positive prior to starting school.
Yes.
And it's like, come on now, where's the social responsibility? Did you quarantine? Did the student quarantine? Did the parents ensure the child quarantine? Are the parents quarantining? Are they, taking measures not to spread it to anyone else? And again, as we said, leadership. It goes back to elected officials, and though we know that in Georgia there's a fight. There's a fight between the mayor of the biggest city in Georgia and the governor, and it's crazy. How do you not shut down? Everybody else has shut down and is doing well. New Zealand, Australia, all these countries are doing well because they shut down. They adhered to the policy. They all work together. They didn't file lawsuits against one another and do this nonsense because it wasn't about them. It was about the people. And, that's why they're out of it. And people can travel between borders with them. And that's why the United States can't go, because we can't get it together. And it comes down to leadership. So, thank you, Brother Dunn, Jerome Dunn, for making us aware of that.
Well, Chicago they just flashed up that Chicago is opening their schools pure 100% viral, period.
There you go. Period. With a T. Thank you, Chicago. Tone, you got anything you want to say before we
just want to say real quickly, thank you again, Tassan, and to all the educators. I appreciate you.
Yeah.
People don't know how hard you work and what you do for our scholars, but coming from law enforcement, I see what you do. I appreciate you. It's
Me too.
I appreciate it.
Thank you. Yeah, Brother Tyson, man, listen, we thank you, man, and we want you to, give us something to walk away with and keep thinking on, pondering. So, what's your last final thoughts on today's show?
Well, first and foremost, I'd like to thank you because, like I said, I watched the show and I admire you guys greatly. Brother Cox came in and helped us out quite a bit with a lot of the things that we've done with the children in the community outside of the schools, which I'm a firm believer of. I do want to speak to the parents, the teachers, and the educators. We have to work together to make this happen. Please keep in mind no one knows the perfect answer. There just isn't. Everyone has high expectations of school systems, which they should. You should definitely have high expectations. However, please keep in mind what's going on with this pandemic. Everyone's just trying to figure it out and make good decisions.
Mm-hmm.
God, we have to take the politics out of saving people's lives.
Yes.
We have to, because we know the communities that are going to get hit first are going to be our communities.
That's true.
We're going to get hit the hardest because we are already bringing a lot of issues to the table. So let's work together and let's fight. Let's get rid of the politics, and we should be all right.
Yes, man. Hey, man, thank you for listen. That you couldn't have said anything better to our viewers. Viewers, I hope you were paying attention and you listened to that because that's from the inside. You know, that's right from the horse's mouth. That's a plan of action right there that needs to be executed. Take the politics out. Let's have serious discussion and make sure that we are protecting our children. I know we all love our children, and one of the worst things you can do is be in the hospital or have your child go to the hospital. You cannot be there for the last moments and they tell you that your child or even you, I don't care what, listen, I've worked for 3 months. I've worked supporting the front line. When you go to the front line of a war, you see atrocity. You see things that you don't even want to talk about. And I'm telling you, the numbers are real. The deaths are real. All that nonsense you hear about, they're getting more money for to say that it's COVID. No, that's not true because what it is, everything is documented. And they do get money for COVID because they have to, because COVID is a pandemic. So in order to keep the hospitals open and keep supply supplies and get the equipment and pay the staff, they have to get federal funding. That's what they're getting from the government because the country was under a state of emergency, a national state of emergency. So forget about all of that. The reality is we have to make serious decisions, real, concrete, thought out decisions about moving forward because September is right around the corner. And I am talking about opening our schools up and sending our babies back to school. You better be at those meetings virtually. I don't care if you got to go outside. We can protest about everything else. We better protest for our babies.
That's right.
We want to make sure that they are introduced back into a safe environment. And whatever that safe environment is, you want to have a voice. So that's why we did this show at Protect and Serve. That's why we brought our brother Tyson in, because we knew who to go to get some answers. And that's what we try to do, is bring the people who have the answers to you, the viewers, so you can make better and more informed decisions. So listen, we're out of time, but we're going to follow up with this. We thank you for tuning in tonight. I want to thank my guest, Brother Tyson. Oh, there we go. We can't, 90 days out, 90 days out. Vote, 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 vote. We want to thank Brother Tyson for coming in and sharing with us. We do not take it lightly that you took time out of your schedule to come and talk to us and our viewers. We thank you again. To Steffi Treadwell, Anthony Cox, thank you for always being there for me and contributing to this discussion and this dialogue. I'm John Arnold from Protect and Serve. Have a wonderful night. Stay safe. We'll see you next Wednesday at 6 p.m. right here at Protect and Serve. God bless you and have a good night.
Peace.
Take care.
Bye-bye.
Peace out.